we're trying to do with this amendment, what I am hoping happens with the adoption of this amendment, is that we refocus the mission of our health departments in providing good information. The bill itself is wanting to help ensure that health departments will provide evidence, science-based medicine for some of these emerging illnesses that we are inevitably going to face again. What we learned from COVID is if we react swiftly and harshly, we don't always get it right. And taking a pause and just making sure that we focus on the damage that can happen based on our response is really where we need to be, so we can inform the public and allow them to make their own decisions. So I urge this body to adopt this amendment so we can start to rebuild public trust. So vaccine mandates are not the way forward, really, for any outbreak. I speak on this with authority. My professional background did not start just as a physician assistant. My first college degree was from George Washington University, and it was in medical laboratory science. My first job in the military was in the Department of Pathology, Immunohematology. That was my first military job. I worked on the immune system. I tested the immune system. When we look at who should be receiving vaccines, we need to target specific groups of people based on their risk factors. We know that COVID targeted people that were immunocompromised, people that were elderly. But we also know now, by not knowing the science, that an all or nothing approach is not correct. We heard from the good gentleman in the 31st about what happened to employees in this state because of the mandate when they had concerns about an experimental vaccine. These concerns proved warranted. I myself have a very similar story to the story that we just heard regarding heart palpitations after receiving the vaccine. My medical license was threatened. I was given an ultimatum that I would not be able to support my family, and I knew that I was low risk. I had never had a heart condition before. I now have a cardiologist. I have periodic check-ins, and there is no reason for that except for palpitations that started about 72 hours after the first vaccine and put me in the hospital for the second. I now have a medical exemption, and I'll never take an mRNA vaccine again. However, I never should have had it in the first place because I had no risk factors. We need our health department to not mandate. We need them to inform and allow informed decisions. We need to do better. As I've said before, our state no longer trusts our health authorities. Our physicians are losing their trust. I rise today in support of this amendment. November 2019 was the first time I was elected to public office, and I served on a school board. Little did I know, one of the first things I would have to do is navigate a worldwide pandemic as a public official that was going all across our country, world, tons of uncertainty. It is not something that I was anticipating. Now, something that came from that was being put into the place where there was very little guidance, and then there was a vaccine, and then there was a vaccine that was widely available, and then it was mandated. And then it was mandated unless there were some exemptions, like we're trying to codify here. Those exemptions were interpreted differently depending on where people were. The health departments were unable to provide good guidance on what was a religious exemption, and there was limited guidance coming from the state, from this body, as to what is an acceptable religious exemption. What I am hoping we can do by passing this is say that a religious exemption or a parent's exemption is enough. When I was on the school board and having to look at some of these decisions, and we were asking questions as a board as to why you're requesting an exemption, the privacy invasion for some of the employees was more than they wanted. And so we had an employee who agreed to not come in at all until the pandemic was over or there was more information on the vaccine. We asked this person to do a religious or a medical exemption if they could. They were afraid that we were going to breach their privacy and refuse. Our board then got a letter from the Attorney General's office threatening to sue us and name us as individual board members and seek our personal assets as remedy unless we complied with firing, terminating this employee who was afraid to disclose some of their personal information. We need to have
Excuse the interruption. The member has about 40 seconds remaining. Please proceed.
Thank you, Madam Speaker. Where I was going with that is we need to have a robust exemption system that people can trust, and this amendment would do that. I urge you vote with me in yes. Thank you. I have a couple of issues with this piece of legislation. First is going to be in the intent section. I'm going to paraphrase. We're talking about the intent is not to limit or expand. Which, I guess my real question is, what are we trying to do? And then why do we need an emergency clause? So, I do know that there is importance in giving good data, especially to the public, especially after what we've done to public trust. We heard that there is some concerns with the data. The concerns that I've got with what the legislation says is really what happens when the science that is used by the health departments is wrong. Which we know now, it has been wrong. It took years, but the 6-foot rule wasn't actually based on anything that we knew about COVID. However, there is still the scars of some of our small businesses and restaurants where we have 6-foot spacing, because that was the available science. But it was based on something that wasn't even a COVID virus. The concern here is we're using available science in a vague manner, which is likely going to be found void for vagueness. I suggest, moving forward, we find ways to fix this and use something like peer-reviewed science. In the meantime, I urge a no on this legislation, and I encourage you to do the same.